talk today about transmission of COVID-19. I read a very interesting paper that's been published in the New England Journal of Medicine a few days ago, and in this study the scientists did some interesting things. Well, the first thing they did was they sprayed COVID-19 into a contained airspace. So we had COVID-19 in droplet format. Then they looked and tried to measure COVID-19 in the atmosphere where they sprayed it for a period of time. And they found that they could measure COVID-19 for as long as 3 hours after they did it. So it stayed in the airspace for quite a long period of time. If they then look at surfaces, they found that COVID-19 could last on stainless steel for up to 48 hours, on plastics for up to 72 hours. And an interesting point here, a lot of people have gone from drinking out of stainless steel bottles into plastic bottles. If you're going to do that, throw the plastic bottle away. Don't keep it and refill it. If we looked at cardboard boxes, COVID-19 can last for 24 hours on cardboard, so that's a concern when we get deliveries. The point that I'm trying to get to here is that in public spaces, I'm sure that you can get COVID-19 transmission from aspiration through cough. So if an individual coughs near you, you could inhale that COVID-19 in that droplet format atmosphere. And if you touch surfaces and you don't wash your hands, and you touch your mouth or your eyes or your nose, MEN, avoid men, then you're going to transmit it by contact. But for healthcare workers, where there is great concern, there's an important point to learn here, and that is this, that when we perform tasks where an aerosol transmission could occur, for example, when we intubate a patient, we put a tube into someone's lungs to ventilate them, or we wash the lungs out with a saline solution to clear the sputum, or perhaps even when we perform a task like opening the breastbone, where we get an aerosol spray. Those tasks in themselves may be of high risk when we perform them for viral load and transmission, but also for a number of hours afterwards. So it's really important that personal protective equipment is understood in terms of how it's used when we perform tasks, but also how important they are for a period of time afterwards. And if you're going to spend a whole shift in an intensive care unit full of COVID-19 patients, it's really important to understand that PPE is required throughout. For now, and for as long as we're able, we will be performing cardiac surgery with full PPE, and that's after consultation with our clinical teams and our microbiologists. And that's going to mean that we are going to need an increased number of personal protective equipment going forward. Anyway, some thoughts there for you. All the experts that listen to this, microbiologists, public health doctors, if you've got any great ideas or other ideas, please do share them under this video. Bye for now.